This is the Coronavirus Morning Report for Monday, April 13th, 2020. I'm Brian McCullough. A lot of 2 steps back, along with today's 1 step forward numbers. Is Britain on track to have the highest fatality rate in Europe? Is Florida undercounting deaths from snowbirds? A deep dive into the Google and Apple contact tracing technology. It's hard to believe at this moment in time, but medical staff are actually getting laid off right now. And more on what it's like to be on a ventilator, but more importantly, what it's like to come off of one too. As I said, today has been a day of retrenchment in terms of good news. The U.S. over the weekend became the first country in the world to report 2,000 deaths in a single day relating to coronavirus. Almost 100 new cases were reported in China that were linked to people returning to China from Russia. Another small study of chloroquine use in coronavirus patients was halted in Brazil as patients in the trial again developed irregular heart rates, and 11 out of the 81 patients in the study died after 6 days. Singapore, which has long been held up as a place that handled the initial response to the outbreak well, confirmed 233 new cases and 7 new clusters overnight, making that the second highest daily increase in the country so far. What is especially worrying is that Singapore has not seen any imported cases for 3 days, which might indicate local transmission there has picked up again. And the Japanese island of Hokkaido, which had previously ended its stay-at-home orders, has reversed course and entered a new state of emergency. Quote, "We are facing a crisis of a second wave," Hokkaido's governor Naomichi Suzuki told reporters. People are growing steadily more concerned about the UK, where we have been following the various back and forth in terms of how soon and how seriously the response to the crisis there was taken by the government there. If the latest trends continue, it looks like Britain could report 10,000 dead this week alone. And the worrying part of the trend is that it looks like Britain might be on a worse trajectory than Italy was. Officials fear that Britain's mortality rate might already be or might soon be the highest in all of Europe. Conversely, Spain is beginning to ease its lockdown restrictions, allowing construction workers and other vital sectors to return to work this week. France, however, is looking to extend its lockdown even as the numbers of cases and deaths appears to be reaching a plateau in that country. Italy reported just 431 new deaths on Sunday, the lowest increase in fatalities in 2 weeks. And for the 9th day in a row, fewer people in Italy were being hospitalized in intensive care. The trend is now trustworthy. Luca Ricceldi, a pulmonologist who is on the scientific committee that is advising the Italian government, said at a news conference, "Putting together the drop of people being hospitalized, patients in ICU, and the number of people dying, we can say that the measures that were adopted and extended are having an impact on this virus," end quote. Australia and New Zealand plan to keep their restrictions in place despite a sharp slowdown in new coronavirus cases in both of those countries. Quote, "Now is the time to stay the course," Australian Health Minister Greg Hunt said in a news conference. "We are now seeing consolidation of the flattening of the curve. That doesn't mean we are out of our challenge," end quote. And South Korea only reported 25 new cases overnight, a new low for the past 7 weeks in that country, with a recovery rate now reaching around 70%. Quoting from the Washington Post, "The creator of an influential U.S. coronavirus model said a resurgence in cases is likely in the U.S. if the country reopens by May 1st, and that the second wave would probably hit in July or August," said Christopher Murray, director of the Institute for Health Metrics and Evaluation at the University of Washington, on CBS's Meet the Press on Sunday. Murray warned the country will need to address interstate travel and trade before reopening, so the virus is not transmitted across borders in states that have steered clear of it. He said Texas is among several states that have made exceptions to their lockdown restrictions and pose an unknown risk to other states, end quote. And quoting from the Washington Post again, Smithfield Foods, one of America's largest pork processing facilities, said it will close until further notice, a foreboding sign of how the pandemic may affect the labor-intensive meatpacking industry. Quote, "The closure of this facility, combined with a growing list of other protein plants that have shuttered across our industry, is pushing our country perilously close to the edge in terms of our meat supply," said Kenneth Sullivan, the CEO of the Virginia-based meat processing company, end quote. And some worrying news out of Florida. in terms of our ongoing worries relating to accurate numbers and statistics. Quoting the Miami Herald, on its public website, the Florida Department of Health says about 1,400 Floridians statewide are waiting for their coronavirus test results. But that's an undercount, the department acknowledged in response to questions from the Miami Herald, and it's likely a massive one. That's because the state only reports the numbers of Floridians waiting to hear back from state labs, not private ones. And those private labs are completing more than 90% of Florida's tests. The state website doesn't say that its figures exclude the vast majority of pending tests for the novel coronavirus, end quote. And quoting from the Tampa Bay Times, quote, the state health department is counting coronavirus deaths only for people who claimed residency in Florida. Conversely, the medical examiners, who are legally responsible for certifying fatalities from diseases that constitute a threat to public health, are counting anyone who died in Florida, including snowbirds and visitors, end quote. In other words, Florida currently isn't counting the deaths of snowbirds, those seasonal residents from other states who reside in Florida around this time of year in their many millions. So, if, say, an Ohio resident dies today in Florida of coronavirus, Florida doesn't count that death in official Florida death tallies. It's unlikely that then Ohio would include that death in their tallies. So not only could death numbers in Florida be artificially low, but the knock-on effect might be that death numbers nationwide could be reduced as these Florida cases merely fall through the cracks, unreported anywhere. This happened late on Friday, but it's huge news relating to some things that we've been talking about a lot on this show recently. Tech arch rivals Apple and Google announced that they are teaming up to develop a coronavirus contact tracing system. As we've covered extensively, relentless testing combined with sophisticated contact tracing, as has been implemented by countries that have successfully flattened the curve of new infections, is an essential part of opening up society before a vaccine is widely available. The system from the two companies, which will be voluntary in nature, will use short-range Bluetooth to keep track of which phones have been in close proximity to each other. Official apps from public health authorities will be able to access this data through application programming interfaces, or APIs, that the two companies will release next month. Users who download those apps will be able to use them to report a COVID-19 diagnosis, and those same apps will then alert other users if they've been in close contact with a person that has been diagnosed. Both Apple and Google say they're committed to preserving privacy throughout the process. Quoting from The Verge, unlike, say, some other methods, like using GPS data, this Bluetooth plan wouldn't track people's physical location. It would basically pick up the signals of nearby phones at 5-minute intervals and store the connections between them in a database. If one person tests positive for the novel coronavirus, they could tell the app they've been infected, and it could notify other people whose phones passed within close range in the preceding days. The system also takes a number of steps to prevent people from being identified, even after they've shared their data. While the app regularly sends information out over Bluetooth, it broadcasts an anonymous key rather than a static identity, and those keys cycle every 15 minutes to preserve privacy. Even once a person shares that they've been infected, the app will only share keys from the specific period in which they were contagious. Crucially, there is no centrally accessible master list of which phones have matched, contagious or otherwise. That's because the phones themselves are performing the cryptographic calculations required to protect privacy. The central servers only maintain the database of shared keys rather than the interactions between those keys, end quote. Once the system is up and running, Apple and Google plan to build the functionality into iOS and Android respectively at the operating system level to allow as many people to participate by opting in as possible. In a joint statement, the companies said, quote, all of us at Apple and Google believe there has never been a more important moment to work together to solve one of the world's most pressing problems. Through close cooperation and collaboration with developers, governments, and public health providers, we hope to harness the power of technology to help countries around the world slow the spread of COVID-19 and accelerate the return of everyday life, end quote. Some of you probably know, if you know me from my other podcasts, that I come from the tech industry. So the Google and Apple contact tracing news was sort of a case of my worlds colliding over the weekend. From a tech perspective, it's amazing that Google and Apple are joining forces, as they are basically blood rivals at this moment in time. But at the same point, they're the only ones who could meaningfully set the table for the technological tools we might need. In iOS and Android, the two of them own the platforms that 90% of the world's smartphones run on, and by actively baking these tools into the operating system level, they could potentially make it possible for any number of apps to be built on top of that fundamental layer. The bottom line is, Google and Apple have laid the groundwork for exactly what we will need for the next phase of this crisis. And they did so out of the blue, without even being asked, which is sort of amazing. But this hasn't solved our problem overnight, because they've done just what I said. They've set the table. The question will now be, who will step up to make something out of what they've done? Let me share with you a tweet thread that got a lot of attention in Silicon Valley circles over the weekend. Ben Adida was formerly at Square, at Mozilla, at Harvard and MIT, and is currently the executive director at VotingWorks and is on the board of Creative Commons. Let me quote from his tweet thread extensively. Last night, I spent some quality time with the Apple docs on the new contact tracing protocol and APIs they and Google are preparing. I'm quite optimistic about this effort. Here's why. First, my understanding of the health experts' point of view. If we want to reopen society once hospitalization rates are down and testing is more broadly available, but before we have widespread vaccination, we'll need contact tracing to rapidly contain any outbreak. Contact tracing is this. Say you test positive, we want to very quickly find everyone you were in contact with over the past 2 weeks and test them too. Anyone testing positive is then quarantined to contain the outbreak. Can cell phones help with this contact tracing? Obviously they can. Smartphones know where you are at all times and could dump all that geodata into one big database and just query it when someone tests positive. Dystopian much? Can we do contact tracing less invasively? There's the possibility of using cell tower records, but one problem, it seems, is that this would yield a lot of false positives because cell tower location is not sufficiently precise. Even if it works, dystopian hellscape. The key idea is that we don't actually need geodata. We just need to know who was in contact with whom during a 2-week span. Whether it was at the gym or on the bus doesn't matter for our purposes. And we don't need a big dystopian database. Much of the data can stay on phones. That leads to a number of similar proposals, including Google/Apple's, MIT Pact, and others that roughly do this. Each phone locally broadcasts an identifier using Bluetooth. Phones then record identifiers they see from other phones in close physical proximity. Phones change the identifier every few minutes so that you can't correlate identifiers across long periods of time and track people. And when someone tests positive, their phone releases the identifiers used over the last 14 days to a database. Phones then download positive identifiers from the database, and if they see one that matches their list of encountered identifiers, they light up and say, "You've been in contact with a positive person. You should get tested right away." Different proposals have different parameters for how often identifiers are changed and different mechanisms for phones to prove they actually generated those claimed identifiers, so disruptors can't pollute the system with false claims. There are also cool tricks used to reduce the amount of data phones need to upload and download. The Apple/Google proposal has phones releasing a single daily tracker from which all of that phone's identifiers for a whole day can be regenerated and authenticated. So what exactly have Google and Apple done? They defined technical details for generating, broadcasting, recording, and revealing identifiers common across iPhones and Android phones. They defined an interface through which apps can use this tracing capability. This means a large part of the tricky stuff, generating identifiers, rotating them, finding others, and recording them, is done once by capable cryptographers. Very cool. Also, the docs indicate that a phone won't release its identifiers unless the user approves. Also cool. So this is pretty great. Data stays on the phone, and release of identifiers is gated on the user. There are some nits to be debated, like how linkable identifiers are. Could we do this without linking together all the daily identifiers of an individual who tests positive? Also, Apple and Google are not operating the database of positive identifiers themselves, at least for now. They're letting other apps do that. With this API in place, Apple and Google's role could be to aggressively police the contact tracing apps. They should use the API, and maybe only some are approved, which would be good. But we're left with three big questions. Who's going to build the actual apps and positive identifier databases? How do we get enough users installing those apps to make contact tracing work? And how do apps decide that a user has been truly infected so this doesn't get abused? Here is one possible path forward that answers those questions in a way that I think could work well. County-level health departments are the ones that produce the apps. Maybe clumps of counties band together. For example, all of the San Francisco Bay Area counties. That means declaring a user positive would be gated on health departments, so abuse is limited. It also means a county could decide, based on adoption, how safe it is to reopen. The incentives are aligned nicely. Install your county health app so we can reopen for business. Another way it could go, and Apple kind of hints at this in their announcement, is that Apple and Google could take more drastic action to strongly encourage installation of an app. Maybe a system notification to everyone. As long as Apple and Google do constrain which apps get to use this API and frown on apps using more invasive approaches to contact tracing, this direction feels quite good. Contact tracing is necessary to reopen society before vaccines. This looks like a good way to do it. Two more details. The reason this is pretty good for privacy is because contact tracing is designed for when the pandemic is under control and only a handful of people are testing positive every day. So only a handful of people's location data is released. Also, if we're indeed going to see counties pushing out these apps, the best way to go is to have one open source implementation that can be white labeled by health departments. Who, though, is going to build the open source app and backend that runs against these APIs? One last idea. If the app is built by a health department, it can help prioritize testing. Imagine showing up to a testing center with your county health app showing the "you need to get tested" screen, and you're immediately prioritized. No questions asked, no insurance needed, end quote. If I told you that medical professionals are getting laid off at this moment in time, you almost wouldn't believe me, right? However, we know that hospitals and medical facilities across the country have been canceling elective and non-urgent medical procedures to cope with the influx of coronavirus patients. And thus, a new report says, that is having the unintended consequence of medical workers getting laid off in the middle of a pandemic. The canceled procedures were, for some hospitals, a main source of income. Now starved for revenue, hospitals are furloughing workers or making them take unpaid leave just when their skills are needed the most. Quoting from the Washington Post, last week, Bon Secours Mercy Health, which runs 51 hospitals in 7 states, announced it would furlough 700 workers. On Wednesday, Ballad Health, which operates 21 hospitals across Tennessee and Southwest Virginia, delivered the same bad news to 1,300 employees and said executives would take pay cuts. Employees at Children's National Hospital in the District of Columbia were informed this week that they must take off 1 week, either using vacation time or, if they have none, unpaid leave. Hospital executives and analysts emphasize that not all the furloughed or fired workers are directly involved in treating COVID-19 patients, but others point out the furloughs help reduce the number of people in hospitals available to slow the spread of the virus. The absences have put a strain on doctors, nurses, and other healthcare workers treating a surge of patients that has already stretched some healthcare systems to the breaking point. Remaining frontline workers face longer hours, and some have seen their pay cut and benefits reduced, end quote. There are even concerns that the weakest hospitals may have to close their doors entirely, destabilizing the entire coronavirus treatment provisions in a given area. The federal government has allocated $100 billion to help hospitals and other health providers offset lost income, but the advisory board, a consulting firm, predicts that that won't be enough because it's an amount equal to just 1 month of total hospital industry revenue. For the moment, the federal government will dole out aid based on how much hospitals bill Medicare, potentially disadvantaging hospitals that treat more Medicaid or uninsured patients. The American Hospital Association has recommended that health systems in COVID-19 hotspots like New York and Detroit receive a $30,000 lump sum per bed to offset lost revenue and help them keep functioning at maximum capacity. No word yet, though, as to whether the government will respond accordingly. Spending more time inside and alone than usual, it's easy to get stuck in anxious thought loops like worst-case scenarios, what-ifs, ruminating about the past or projecting into the future? With social distancing, we need support now more than ever. Talkspace Online Therapy gives you the support you deserve on a schedule that works for you. Talkspace lets you match with a licensed therapist from the safety of your home. Get 24/7 messaging access to your therapist on any device and hear back daily. Talkspace therapists have experience treating a range of issues, including depression, anxiety, substance abuse, trauma, relationship issues, food and eating, and more. Security, safety, and privacy are top priorities at Talkspace. Their platform encrypts and securely stores all client information using the same technology used by the banking industry. We all need to talk through life's challenges. Talkspace offers the support we deserve at a price we can afford. Match with your perfect therapist and get $100 off your first month with promo code BRIEFING. Sign up at Talkspace.com or download the app. Don't forget to use promo code BRIEFING for $100 off your first month. Stamps.com brings all of the services of the U.S. Postal Service right to your computer in the safety and comfort of your own home, office, or anywhere else you're hunkering down right now. I've been telling you about how this allows you to stay inside and avoid crowds like we all should be doing right now, and I've told you how this will help small businesses continue to function even while working remotely. But did you know Stamps.com also saves you money? With discounts you can't get at the post office. You get 5 cents off of every first-class stamp, for example, and up to 40% off USPS shipping rates with Stamps.com. And now, in addition to offering discounted U.S. Postal Service rates, Stamps.com also offers UPS services with discount rates up to 62%. Plus, with Stamps.com, you won't even have to pay UPS residential surcharges. Stamps.com is a no-brainer, especially now, saving you time and money and keeping you safe in these crazy times. Right now, listeners to this show get a special offer that includes a 4-week trial, plus free postage and a digital scale without any long-term commitment. Just go to Stamps.com, click on the microphone at the top of the homepage, and type in briefing. That's Stamps.com, enter briefing, BRIEFING. Stay safe, everyone. One option to offset the short-staffed situation in hospitals would be for more comprehensive planning around the treating of coronavirus patients at home. Unfortunately, as we've seen hinted at in conversations about the true number of coronavirus deaths, many people who are told they have mild enough symptoms to recover at home end up taking a turn for the worse and thereby end up dying before they make it back to the hospital. Researchers at University Hospitals in Cleveland are running a pilot program that will hopefully save the lives of such individuals. Quoting CNN, patients who come into the emergency department but aren't sick enough to be admitted to the hospital are sent home with a sensor to wear on their finger. The sensor measures oxygen levels in their blood and sends signals to a wrist monitor that looks like a watch, which then sends signals to their cell phone. That data then goes to a central monitoring station where doctors and nurses can monitor the patient's condition minute by minute, end quote. One of the issues at play is that many patients progress to respiratory failure very quickly, and when that happens, they may struggle to call 911. Leonardo Frazier, an Ohio patient who was given one of the sensors after going to the hospital and being told to recover at home while they monitored him, says the sensor saved his life. When his oxygen levels dropped and his blood pressure spiked, he got a call from his doctors who told him to go to the emergency room. Frazier says that he was home alone that day and might not have been able to make the call himself. However, even with that caveat, if the sensor were rolled out on a large scale, it could save countless lives. In New York City, for example, City Councilman Mark Levine says people are dying at home in such high numbers that they're not even testing them for coronavirus. He said on Twitter, quote, "We simply don't have the testing capacity for the large numbers dying at home," end quote. And as we covered last Tuesday, ventilators are not a panacea for surviving COVID-19. You really don't want to end up on one because the odds of coming off it alive in the context of coronavirus are essentially a coin flip, 50-50. But that situation was exactly what happened to lawyer and author David Latt, who wrote about his experience in the Washington Post this weekend. Latt was admitted to New York City's NYU Langone Medical Center with the coronavirus on March 16. An asthma sufferer, he was having difficulty breathing. After 4 days in a stable condition, he took a turn for the worse and ended up spending 6 days on a ventilator, quoting from his piece in the Post. A few days earlier, after my admission to the hospital, my physician father had warned me, "You better not get put on a ventilator. People don't come back from that." As the nurses prepared me for the intubation, I thought to myself, it's not my time to die. My husband and I have a 2-year-old son. I want to see him graduate from high school, graduate from college. If he gets married or has kids of his own someday, I want to be there. I started praying the Hail Mary over and over. I have hazy memories of the intubation itself. My anesthesiologist was a woman with a slight Caribbean accent and an authoritative, reassuring demeanor. In my overwhelmed state, it seemed that a dozen people were in the room, when in reality it was probably just a handful. Aided by anesthesia, I soon fell asleep. I spent the next 6 days basically asleep under sedation, the ventilator serving as my lungs. I remember nothing from this period. I have since learned that some patients have nightmares or hallucinations while on ventilators, so I view myself as very fortunate, end quote. On day 6, Lat's doctors faced the choice of taking him off the ventilator or inserting a tube directly into his windpipe. Fortunately, Lat was able to breathe on his own with supplemental oxygen and successfully came off the ventilator. But his experience did not end there, and he writes about the lasting effects of being on a ventilator. Quote, "Many patients who come off ventilators suffer lasting physical, mental, and emotional issues, including cognitive deficits, lost jobs, and psychological issues such as depression and post-traumatic stress disorder. For me, my lungs must rebuild their capacity. I experience breathlessness from even mild exertion. I used to run marathons. Now I can't walk across a room or up a flight of stairs without getting winded. I can't go around the block for fresh air unless my husband pushes me in a wheelchair. When I shower, I can't stand the entire time. I take breaks from standing to sit down on a plastic stool I have placed inside my bathtub. Being on the ventilator for almost a week damaged my vocal cords, and now my voice is extremely hoarse. My speech pathologist expressed optimism that the damage is not permanent, but only time will tell. I'm not complaining. I am incredibly grateful to be alive, and for that, I have the ventilator to thank," end quote. That's all for today. As always, this show was produced by Ride Home Media. Talk to you tomorrow. Be well, everyone.